Hi, Corey, can you hear me?
Loud and clear. All right, we can go ahead. Good morning, and thank you for joining the Washington State Department of Health Media Q&A
Corey,
this
can you
morning.
hear me?
Yes, loud and clear. For the rest of the panel, can we do a quick audio check? Can I get a thumbs up? Excellent. Dr. Shah, do we have audio for you? All right, Dr. Shah, do we have audio for you both ways this time?
Hello?
We have you loud and clear.
Hello?
I can hear you, Dr. Shaw.
Hello? Hello? Corey, can you hear me?
Yes, I can.
Okay. I cannot hear Corey.
Can you hear me?
We're going to continue working on audio with Dr. Shah to keep us moving and to make up for lost time. Again, appreciate everyone's patience this morning. I'd like to introduce our panel and of course, begin our Washington State Department of Health Media Q&A on the Say Yes COVID-19 test program launching today. I'm your facilitator, Corey Portner, and I'd like to welcome our panel, Dr. Umair A. Shah, Secretary of Health, Lacey Fehrenbach, Deputy Secretary for Prevention and Health, Les Becker, Deputy Secretary for Innovation and Technology, and Jared Davis, Assistant Secretary for the Division of Disease Control and Health Statistics. And it does look like Dr. Shah is connecting to audio currently. Keep our fingers crossed. And Dr. Shah, we have you again. Are you able to hear us?
Hi, Corey, can you hear me?
Loud and clear.
Oh my goodness. Gosh, that was awful. Okay, well, I'm on by audio with my phone. For some reason, my video's not allowing me to do the audio. So we can get started whenever you're ready.
Go ahead. We'll open with remarks from Secretary of Health, Dr. Umair A. Shah.
Well, hi, good morning, everybody. And Corey, let me just to make sure you can hear me okay, right?
Yes, loud and clear. We got you coming in strong.
Perfect. Well, I want to just start. First of all, apologies for the audio difficulty there. Good morning. Thanks for joining today. As you know, yesterday we commemorated the 2-year anniversary of COVID-19, our first COVID-19 case in Washington and the United States by visiting partners in Everett, Providence Everett Hospital, Everett Clinic, our vaccine site at Everett Mall. We want to make sure people get boosted, and certainly our Shoreline laboratory facility at Washington Department of Health. The reason I bring these visits up is one of the common themes we heard yesterday was that though we are 2 years into this pandemic, we must still do everything we can to fight the fight against this pandemic, this virus. That said, the tools that we have are not just for those that are in response agencies, but also to empower people with information and the ability to be able to make good decisions as we continue to move forward in this next phase and continued phase of this pandemic. So in that spirit, let me get to today. As you know, Governor Inslee recently announced that our state was in the process of purchasing at-home tests for Washingtonians. He described 1 million tests that were going to go out to schools, another million that were going to go out to local partners, and 3.5 million tests that were going to go out to everyday Washingtonians. He also said that mid-January, we were going to get those tests as long as we had the supply and the procurement, and that certainly has been a challenge. It has remained because of all sorts of reasons, but our team has been working through all those reasons to get those home tests in the hands of our department and ultimately to be able to get them in the hands of Washingtonians. Let me be clear, we've made tremendous progress in getting those tests, but we do not have the full 3.5 million tests in hand. We only have a portion of those in the numbers of about 650,000. And as you know, supply shortages are impacting everyone, and we are no different. So why am I giving you this background? Though we have only received a portion of our tests, we felt it was important not to hold on to the tests that we have, but to get them out as quickly as possible. We felt very strongly we wanted to get the tests out into the hands of Washingtonians as quickly as we could. We also know since the governor's announcement that, and starting earlier this week, the federal government also opened its portal, and we can certainly share that URL as well for ordering, and that is absolutely great news as well. So today we're excited about launching our portal for the ordering of these tests, and you will hear from Lacey and Les on what our plans are and how Washingtonians can order these tests beginning today. Given that the supply will be limited, we expect that once we launch, the demand will be high and we will see a lot of interest. That means not everyone who wants a test will be able to order a test today through this process, especially given the limitations I just mentioned. So expect once we launch, we get the portal going, not everyone is going to be able to get on, not everyone's going to be able to order, or the site may even, due to overwhelming demand, go down at times, and patience is the word. However, we are so excited to launch regardless to ultimately get tests out to Washingtonians, and we will be replenishing supplies, more supply of tests come in until we exhaust the full 3.5 million test commitment that we have ordered. So this is great news, and we're excited to keep serving Washingtonians. Let me now turn it over to Lacey and Les to give you some more specifics.
Thanks, Dr. Shah. So beginning today, the website will go live, and Washington residents will be able to order rapid at-home antigen COVID tests online to be delivered to their home at no cost. This is a statewide expansion of a partnership with Care Evolution and Amazon, following a pilot project that the state participated in with the National Institutes for Health. That partnership previously delivered about 800,000 tests to parts of eastern and rural Washington. When the site goes live, households can order up to 5 tests for free, 1 test kit per household. That will include delivery. As Dr. Shah mentioned, supply will be limited and will restock as additional tests come into the state. We absolutely anticipate that when the site goes live and in these first few weeks, interest will be high and exceed our current supply quickly. But our focus, as Dr. Shah said, is getting tests off of shelves and out into homes as quickly as we possibly can. We want to make sure these tests are in your medicine cabinet when you need them, and not on our shelves or a shelf somewhere else in a warehouse. So this is a really important step towards making tests widely available in the state. And as we work to procure more tests, we also are working with our federal partners to see an increase in the number of tests directly flowing into people's home. I want to also remind folks that there are other ways to get COVID tests, and that includes from the federal website, covidtests.gov. You can also purchase at-home tests at local retailers, pharmacies, and online retailers. If you have health insurance, most insurers and health plans will now pay you back or directly cover the cost of 8 at-home tests per month for each insured person on your plan. And you can also go to DOH's website to find a community-based test site near you. Les, anything you want to add?
Thanks, Lacey. I'd like to add that as over-the-counter testing becomes more prevalent and everyone takes the precautions, a reminder that Washington State is one of the few states that has the ability to accept over-the-counter testing into their exposure notification system called WA Notify. We would encourage everyone to get that on their phone and active before they receive their test, so that if they receive a positive result, they can report it in and their contacts can be notified so they can take the proper precautions as well. And we're excited to have that opportunity as these new over-the-counter tests become available. Thank you, Lacey.
All right, with that, we'll jump straight to our Q&A portion today. We'll start off with Nicole with Cairo Radio.
Good morning. You mentioned that not everyone will be able to get a test right away and that the site might even crash due to the high demand. So what kind of numbers are we looking at for how many people will be able to get a test? Are we talking, half the population? You said there are 3.5 million. How many tests are going to be going out to people?
Yeah, Nicole, thanks for that question. And that's gonna be dependent really on how people order. As Lacey mentioned, you can order either tests in a number of 4 or 5. And so it really depends on how many people are gonna be ordering. That's the first question. And then the other is really as we continue to replenish supplies. So we have about 650,000 tests today in hand that we can put out to be ordered and be ready to be shipped. And we are anticipating, again, this is, procurement and shipping has been the challenge. We are anticipating more tests to come in early next week and then more even at the end of next week. But again, we are doing everything we can to get the tests out as quickly as we have them. I think another message, Nicole, and others, is that we want to make sure people are kind. If you already have tests and you don't need those tests, don't order these tests from the website. Don't just grab them just so you have a supply. If you've got the ability, in fact, if you look in your medicine cabinet right now and you've got 5 or 10, or you've got enough, or you feel you don't need them, or you can buy them somewhere, you can go to the federal website, you can get it from your insurance. Please be kind and do that. This is a limited supply, and we want to make sure we're really making that known to everyone.
Our next question comes from Rachel, AP.
Hi, good morning. A couple of questions. I heard that there's a distinction between the order of 4 or 5. Why split it up in that sort of numerical option? Wouldn't people automatically want the higher number? And then also, secondly, when is the site going live, and when will that link be provided?
Yeah, Rachel, let me answer the second. I'll turn it to Lacey for the first one. The portal and the link, we're actually going to be sending a press announcement out as soon as we have that up and ready. So just be on the lookout for that. We wanted to just make sure you were all aware that we were going to be doing that, so you're not surprised later in the day when you get that press announcement. And then certainly at that point, people can start ordering. Lacey?
Yes, so We are working with limited supply here, and part of this has to do with how the tests are packaged. They are typically packaged in groups of 2, 4, or 5. So that is what is somewhat driving the options. We certainly, recognize that some people may choose 5 over 4. They may only be able to choose 4 at certain points in time based on what is left in stock. So I want to note that. And again, as Dr. Shah mentioned, we really are encouraging people to order what they need and consider their fellow Washingtonians because this is right at the moment, it is a limited supply. It's a scarce resource. And we want people to have access to this as broadly as possible. And we want to encourage patience as we replenish our stocks and more tests become available on the website. And as Dr. Shah said, really, if you have some test kits in your house, like I do, hold off and order later when your supply gets low.
Our next question comes from Lisa with Coin. Lisa, it looks like I don't have you on. If you go ahead and email us if you are on, we'll get you added. Moving on to Paige with KUW.
Hi there. Thanks for having us all today. I am wondering if there's any prioritization of where the initial batch of tests are being sent. Is it simply first come, first served?
Yeah, Paige, we are at this point, it is first come, first serve throughout the geography of Washington. We're not making distinctions. At a later time, we can always make some adjustments, but right now we're really just trying to get them out to wherever somebody is saying that they need a test and they want to order a test. Lacey, did you want to add something?
Just a note that you will only be able to order 1 kit for your household initially, based on the fact that we have a limited supply. So once you've ordered your kit, until we have a vastly different supply chain, you would not be able to reorder another one.
If I may sneak in a follow-up, I'm just curious about how you would prioritize who gets a test in the house. Let's say I've got more than 4 people in the household, some are younger, some are older. Who would you prioritize administering the test to?
Yeah, Paige, thanks. I mean, I think one of the key pieces is to have test accessibility, which, as you know, was a theme of Governor Inslee's testimony yesterday in the U.S. House, was to first start with accessibility. And then we want to make sure we empower people with good information. And so, as you know, on our website, we have a number of bits of information, obviously with a healthcare provider or talking to the local health department. I think it's hard to know exactly in a household who you would prioritize for without knowing the specific scenario. But obviously those who are more vulnerable or have, symptoms that are very concerning, have an inability perhaps to go out on one hand, but then on the flip side, if you have people who are going out, in work environments or school environments, you want to be able to utilize the test. So it just depends. It's really a hard question to answer because I can see both ways of really prioritizing. It just depends on what's happening in that household. I also want to emphasize the covidtests.gov, COVID, tests, plural, TESTS.gov is the federal program by which people can order as well. So we want to make sure to get that information out as well.
Our next question comes from Lisa with Coin. Lisa, thanks for jumping in there. Go ahead. Lisa, do we have audio for you?
While we're waiting for audio, one thing I do want to note is that if people don't have access to web or prefer not to use web, they can and will be able, once the site is live, to order tests through the hotline, the COVID hotline. That will also have language access services.
All right. Next reporter, Bethany.
Hi there. Sorry about that. This is Nick Popham with Como. For some reason, my wife's Zoom is attached to it, so I apologize. But I was curious just sort of how frustrating this situation is with the supply chain, that you aren't able to have the 3.5 million tests available right now. And then with the website, you had mentioned, specific amounts to households. Is it similar to how the federal website works, where if I were to put in my information and then say my wife were to put in information later, it wouldn't work for her because I've already filled up our household with test orders?
That's correct. Thanks for that question. That's correct. It's per household, so it goes by the address. Yeah, I mean, I will say it is very frustrating. This is where we are as a nation, as a country right now, where we are all doing everything we can at the state and local levels to be able to procure tests. And I will tell you, Jared and Les, who are on this right now, they, along with Andy Rose, our incident commander, have been on the phone, have been calling, have had other everywhere from manufacturer to vendor to suppliers who have made assurances, said yes, said it's coming, and it's not. And we were, it's very similar when you see on certain sites where you order something and then you get when the date you expect it's going to arrive, that's when you get the message that it's not arriving and it's been pushed out to an indefinite period of time. This has been very frustrating. I think we need to know that, acknowledge that, and we also have to recognize just how important it is for people to be patient. We are doing everything we can. We're trying to make it known where people can get tests. This is not the only way to get tests, but we have also promised that we are going to get tests out as we get them, and that's what we're doing here. The other thing I think is really critical is that as we are looking at this entire process, it is important to remember that if you have already tests in hand, if you do not need a test right now, if you are feeling like you've got another source for those tests, please get those tests from that other source, and or go ahead and not feel that you have to order today. Please reserve that for folks who really don't have any other way to get those tests. And then the final thing, which I don't believe we've said, Lacey, unless we did, I may have missed it, but we do want to thank Amazon and Care Evolution, who are our partners in the private sector, have just done an incredible job to work with us. And really, I can't say enough about, all of our partners. We've had recent work with Costco over the weekend, Amazon again, Care Evolution, other partners that have just come to the table and have helped us in this very challenging time. So I just can't say enough about that partnership and want to thank them as well. Corey, we'll take maybe one more question and wrap it up by 10:05, if that's okay.
Perfect. All right, Lisa, giving this another go.
Okay, I think we've got it now. My question is, with these individual test kits being sent out at some point in the future in terms of being received by people, when really now is the time they need them, this week, next week, then it starts to go down and it's essentially mute at that point. Why not stand up more mass sites to get people tested now, today, tomorrow, this weekend, next week, during the peak time? Because by the time these individual test kits arrive, the wave will be pretty much on the downside.
Yeah, Lisa, thanks. I do believe that's what's happening. And there are two different modalities here. You're referring to community testing, which agencies and partners are doing, and you're also referring to what we're announcing today, which is at home, to have in people's medicine cabinets. So there are two different kinds of modalities, and we're emphasizing both. And we've been supporting our partners on the ground that have been doing just that. And if you have seen the demand that's been at these sites throughout the state, absolutely, that's already happening. But again, this was an additional modality to help empower people to have access to what was going on. If they had symptoms, if they didn't have access to going to either a healthcare provider or be able to go to, obviously a community testing site. Also, we want to recognize that we've been saying very much, do not go to the healthcare system, to the hospital, the emergency department if people are sick or they have an urgent issue. Testing is constrained across the system, and we want to make sure we're doing everything we can. So I don't think it's an either or, it's an and. We're trying to do everything we can on all fronts. And I'm very proud of the efforts that this department and our partners on the ground have been doing in order to be able to really serve Washingtonians the best we can. But this is an environment that has been tough across the country. And so I do want to make sure that we keep that in mind as well. Lacey, you came off mute. I don't know if you wanted to add something.
Yeah, I do. And I just want to remind people that you can look for a community-based test site on DOH's website. You can also check with your local health department. There have been a number of additional community-based test sites. Community-based test sites stood up at the local level. And there are 2 that the state is supporting in partnership with our federal partners, CDC and FEMA. That are going up over this weekend in Snohomish and King County. So it is a both and, not an either or by any stretch. The other thing I wanted to quickly note, because there were some questions in the chat, for people who do order tests from the portal when it goes live, once you place your order, you can expect your kit to arrive in 1 to 2 weeks.
The other thing, Lacey, maybe this is the last comment we'll make, and then we can close, Corey, is that we did get a question about what if somebody does not have access to tests, given the surge of cases across the state. So, we have been saying if you have symptoms that are consistent with COVID-19, you should assume you have COVID-19 until proven otherwise. In other words, at that point, even if you don't have a test to confirm it, stay home if you're sick, stay away from others, do not expose others, wear your mask, avoid situations where you can get others potentially infected with what you have. So that's a really important message. Again, this is about empowerment. We're trying to do everything we can to get that message out to everyone. We're obviously working on all the tools to help people, but at the same time, we want to make sure people understand what the situation is, what they can do within their own household. So with that, Corey, I'm gonna turn it to you if no other questions. Are we good? Did we answer everything?
We're great. With that, we'll conclude the Q&A for today. I want to thank everyone for their patience as we work through the tech issues, and of course our panelists for their resolve to defeat said tech issues as best as possible. And with that, if we were unable to get to your question, if you have follow-up questions, please email us at our media desk, doh-pio@doh.wa.gov. We'll follow up with you. For those of you in the chat, I'm tracking those and we'll make sure that happens. Lacey's adding comments. Love to see it. And a special thanks to TVW for hosting today's live stream and archives of past briefings. Thank you.
Yeah, Corey, just a reminder for everybody that we will be sending out additional information as soon as the website is live and ready to take orders. So I want to just thank Lacey, Jared, Les, our entire teams that have been working on this over the last several weeks. And I can't say enough about Washingtonians and the resolve and the grit and determination that we have now 2 years in. But we also have to just remind everybody to be patient as we continue to work through these difficult times. But we will work through them and we will get through them. So thank you so much for joining us this morning.